could help because it will extend the lateral wall to the sacrospine. So I think that will be a good idea along with site-specific repair. It's quite a helpful discussion. Any other questions? We will be discussing in the rest because this was only basic science.
As it is based on the topic is anatomy, which is relevant.
Yeah.
Site-specific management.
Yeah.
Through medical and.
Yeah.
So, when we are planning to do a sacrospinous ligament fixation, we can discuss that how to go, from where to go in the posterior vaginal wall so that we exactly reach to that point.
Exactly.
In the pelvis, we can have a demonstration, I think.
Yeah. So the main thing we need to know is the spines.
See, where are the can I demonstrate?
Of course.
Yeah. Where are the sacrospinous ligament attached? Any PG. Come and show me where is the place of attachment of sacrospinous ligament. Come, Supriya. Tell us where is the sacrospinous ligament attached. Promontory. Ischial spine बताओ कहाँ है? Ischial spine. चलो ischial spine बताओ, आराम से देख के, ये है। और sacrospinous ligament कहाँ किसके बीच में होगा? ischial spine और sacrum के बीच में होगा, ठीक है? इसके बीच में होगा ना, लेकिन हमें वो ligament मिलेगा कैसे? How to reach to that ligament so that we are able to put in the stitch and to do the plication. Very good.
Well done.
First thing is we will palpate the ischial spine. Say it loudly. We will palpate the ischial spine. Then what next? But how to reach there, beta? It is very deep. Ligaments are not superficial. So how to reach there? Say what? How I do? The best way to reach to that area is see the posterior vaginal wall. Okay? Seen it? See where is the middle third of posterior vaginal wall is located. Okay? ऊपर होगा, नीचे होगा, middle part होगा. After locating that area, take a 3 to 4 centimeter vertical incision on the posterior vaginal wall. Okay? Can you imagine you are seeing a posterior vaginal wall here and middle third you have located and given a vertical incision. Okay, but before that, what we do, we adrenaline solution, but don't put too much of adrenaline solution. Just 20-30 ml in that area is enough. Why? Because that is going to protect the organ from any injury. Rectal injury nahi hogi if there is a fluid between your rectum and vagina. After giving that vertical incision, do a dissection. Kidhar jana hai, left or right? Where are you going to dissect? Where is rectum situated? Left, isn't it? So where do you want to go? I think I am loud enough. I am loud enough because these things are disturbs. So where is rectum is on the left side? So usually right side sacrospinous ligament fixation is easy, number one, easily done and there is no risk of injury to rectum. One side is enough to take the vagina up and place it normally, right? So once you have given that dissection, dissect the vagina from the pararectal tissue by sharp dissection. Don't come on the opposite. Left side mat aao. Left, you have given an incision, leave it there. Only on the right side that you will have to go between the vagina and pararectal tissue. Okay? And once you have gone deep and you have separated the vagina, just do this action of your finger like this. तो तुम्हारा लेफ्ट साइड है ना, तो तुम्हारे ये just with your finger keep on separating the tissue and keep on retracting the rectum away from your field. When you will reach the deeper part, that means ligament, before that you will come across few bands like what we call rectal pillar. That has to be slowly dissected with your finger. अब sharp नहीं जाओगे, sharp जितना करना था vagina को अच्छी तरह से separate कर लिया. Now you will have to go like this because जो हमें किधर fix करना है, राइट साइड पे करना है ना, तो अपोजिट डायरेक्शन में हमको रेक्टम को राइट साइड लेफ्ट साइड ले जाना है और राइट साइड को क्लियर करना है. वंस यू एवरीथिंग गोज and your finger has retracted the rectum, put 3 retractor. कहाँ? एक तो ये जो lever retractor होते हैं ना, not very big but medium size और small size, एक से तुम rectum को retract कर दो, ठीक है? One will retract up and the other will retract down. 3 direction हो गए ना, एक rectum हो गया, एक ऊपर हो गया, एक side में हो गया. Now the structure which you will see is that ligament which you will have to pass the stitches through. All right. So very easy to, but not very easy for a beginner, but you can do it if you are in the right plane. But you have to be in the right plane and how to move your finger so that rectum is retracted on the opposite side and your ligament becomes visible. Now, once the ligament is visible, there are different methods and Afsha has brought some specific instrument to pass through, but what we do not have that. So, we pass the non-absorbable suture first, उससे पास करके निकाल लेते हैं और little how much, like क्या इसके बिल्कुल पास? No, don't do that. Come 2 centimeter medial. ये जो तुमको स्पाइन फील हुआ है बोन, उसके 2 centimeter medial, and that ligament from the middle part you will have to take. Don't go up, don't go down. Going up you will be injuring nerves and going down you will be injuring vessels. तो ना हमें नर्व इंजरी करनी है, ना वेसल इंजरी करनी है, लेकिन लिगामेंट के मास से लेना है, ठीक है? Which muscle is in close proximity? Coccygeus muscle. So even if your stitches passes through the coccygeus muscle, it's okay, but your stitches will always pass through the, once you have done this dissection, it will pass through the sacrospinous ligament only. And how will you know that you have really pierced and passed through that ligament? When you pull that stitch, you will really face a resistance कि हाँ ये अच्छी तरह से पुल हो पा रही है. Once you pass these 2 stitches, अब क्या करना है? You can do the anterior part, anterior cystocele है उसके साथ associated. अब cystocele के लिए तो एक transverse incision दोगे, वो inverted T, and you have done the dissection, you have taken care of cystocele. Posterior vaginal wall में हमने mid में दिया था, ऊपर transverse दिया, तो बीच में एक bridge of vagina है, ठीक है? It's good that that bridge of vagina is there. Now that vaginal bridge, to pass your finger through that vaginal breach and reach to the most apex part. If you are doing it for wall prolapse, what you do, put 2 stitches. जो wall prolapse का सबसे prolapse part आया है, put 2 stitches on the highest part as a stay suture or as a stitch which will demarcate that this is the apex of your prolapsed vagina. Vault जो भी prolapse है तुम्हें पता रहेगा ना, मान लो यूं करके prolapse है पूरा, तुमने यहाँ एक stitch लगाई और यहाँ, you know that this is the apex part. So once you have dissected to that point, now these 2 stitches, one was non-absorbable, one was absorbable. The stitch which was non-absorbable, that has to be passed underneath the vagina, highest point. vagina के highest point पे underneath that stitches has to be passed, and when we will pull these stitches the vagina will go up. ठीक है, जो vagina के अंदर से, और that stitch which was absorbable that can be passed through the highest point through the vagina, and then time part has to be done last. अब क्या नेक्स्ट करना, तुमने सिस्टोसील रिपेयर कर ली, वजाइना क्लोज आगे का कर दिया, पीछे जो तुमने मिडिल थर्ड काटा था that vagina you have repaired well. Now the last part you do is just pull these stitches. When you pull, the vagina goes up, and this is really, you will be surprised to see कि जो हमने किया था, it is successful once it goes up. As soon as you pull, the whole of the vagina goes up, and then you tie. Non-absorbable and absorbable, both you have passed through the vagina, one through and through which was absorbable. The non-absorbable has to be passed under the vagina. Never let any part of non-absorbable come into the vagina, because that will create lot of problems. So once you have done this, the whole vagina goes up, and your surgery is successful. On table only you can know that this surgery is successful. So reaching there, this is the way, and this is how you do. Some people give vertical incision, whole vertical incision, and then they enter into the peritoneum cavity. This area is located retroperitoneum. Okay? So we need not to open the peritoneum. So without opening the peritoneum, if you want to reach to the right place, that middle third is the area from where you can dissect and you can reach right there. और कहीं नहीं जाओगे, उसी एरिया में जाओगे. And once, as Supriya has said, that you have to palpate the ischial spine, because that ligament will be there at this level also. And 1/3, जब middle 1/3 खोलोगे, so you will reach that. So any point, if it is not clear, I can again repeat it, and those who have seen me operating, I think they can relate it. Naila is nodding, because those seeing is believing, and you understand steps once you see. We don't have a proper model on which I can, like on model, although model are very different from human body. There are, so nobody can make a perfect model as a human body, so things becomes difficult, but I hope I have made it clear, and if it is not clear, I can explain it once more. Thank you, Supriya. How nicely you palpated ischial spine. है ना, पहले सब गड़बड़ सड़बड़ हो गया था. Then rightly she pointed out, these are the ischial spine. No, because the tutorial is on anatomical model, on like anatomy in relation to surgery. So anything else which you want us to explain? And what discussion, when the discussion was very good, that
Thank you, Seema ma'am.
Do all the prolapse cases need to be operated? This is a very big question. Do all the prolapse need to be operated? Big no. Do all the rectocele, even if big, they need to be operated? All the cystocele need to be operated? Symptomatic. But if they are causing, maybe she is not relating to it, but you see that all the time she is coming with urinary tract infection, or you've done an ultrasound for some reason and you find that there are back pressure changes which she doesn't know. Try to find other causes also. ये नहीं है कि कोई भी चीज को खट से ये प्रोलैप्स है, नहीं. There can be other reason also for back pressure changes or hydronephrosis. Investigate it first before you take a decision for advising her for surgery.
Thank you, Seema ma'am. I now take this opportunity to thank Dr. Afsha ma'am, Professor Seema ma'am, and Professor Nasreen Noor ma'am for sharing their valuable insights with us. And I hope this helped us better our understanding of the subject. Thank you everyone who found time for this course. And we will now meet tomorrow, same place, same time. Thank you.